Hi, I'm Nikki Morris. Today I'm going to be doing my head to toe assessment with my patient Leslie. She is my volunteer for the day. This is for my 612 health assessment class. Before Leslie entered the room, she emptied her bladder. She put on her gown. She also had her vital signs and height and weight recorded, which were all within normal limits. She also had her her distance vision tested with the Snellen chart, which was 20/20 with no corrections. Before she entered the room, I had washed my hands. I had assessed her gait as she did walk in, which was also within normal limits. I'm going to start with the physical assessment. I am going to start with her head and face. I'm going to be looking at her eyes and ears, making sure that they are symmetric. I'm going to be inspecting her head, moving her hair side to side throughout the head, inspecting for any masses, lesions, open skin, anything out of the ordinary. Next, I'm going to palpate. Do you have any pain?
No.
And I didn't feel any masses. Next, I'm going to palpate her face. I'm just checking her facial bones for making sure that they are normal. I'm going to palpate her frontal and maxillary sinuses. Do you have any pain?
No.
She's not experiencing any pain. This is normal. Next, I'm going to test her temporal mandibular joint. Can you open wide and move your jaw side to side? Excellent. Doing this, I'm looking for any popping, noises, or crepitus, which I did not feel. Next, I'm going to test Leslie's cranial nerves. I'm going to ask you to do a couple of things. I just need you to improvise for me. Okay. Wrinkle your forehead. Okay, and smile. Stick out your tongue. Close your eyes and shut them tight. And puff out your cheeks. Great. Next, I'm going to test Leslie with light sensation. I'm going to be using a Q-tip that is soft on one end and sharp on the other. I'm going to have you close your eyes, and I just need you to tell me what you're feeling.
Soft. Dull.
Sharp.
Sharp.
Right.
I apologize. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp.
I'm also going to go do her upper and lower extremities at this time.
Soft. Sharp. Soft. Sharp. Soft. Sharp. Okay. Soft. Sharp. Soft. Sharp. Soft. Sharp.
Good. And now I'm going to do her lower extremities.
Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp.
And this was all normal. Excellent. Next, I'm going to be inspecting her Leslie's eyes. Earlier, we tested Leslie's distance vision using the Snellen chart. Now would be an appropriate time. We could test her eyes for near vision using the Rosenbaum chart. I'm going to go on and I'm going to assess. Let me just grab this. I'm going to be looking at Leslie's external eyes. I'm going to be looking at her eyelids for any vacillations or tremors, anything abnormal, the distribution of her eyebrows, and also her eyelashes, making sure that the eyelashes are facing outward. I'm going to inspect her sclera, making sure that they're nice and white. There's no yellowing, there's no injection, exudate, inflammation, nothing abnormal going on. I'm going to check her conjunctiva. pull your eyes for a minute. And they're a nice pink and moist, which is normal. Next, I'm going to inspect her lacrimal glands. And at the temporal aspects, they do not look full, and they do not feel full upon palpation. Next, I'm going to test Leslie's pupillary response. I'm going to do this by using Perla, making sure that her pupils are equal, round, reactive to light, and accommodate. I'm going to stand in front of her for a minute here. I'm going to do this using the direct and consensual method. All right, just look straight at my notes. Here a little bit. Direct, consensual, good. Direct, consensual. This was normal. Now I'm going to do the cover-uncover test. I'm going to have you cover one eye, and hang on a second. And when I say, I'm going to have you uncover. Okay? I want you to look right at the light. Okay, cover, uncover, cover. All right. Uncover. Excellent. This doing the cover-uncover test, we're looking for any jerking and eye movement, and this was normal. Next, I'm going to move on to the extraocular muscles, and I'm going to use the 6 cardinal fields of gaze to test. Okay, I'm going to hold this pen in front of me, and I just want you to follow my finger with just your eyes.
Okay.
Okay. Okay. And this was normal. Next, I'm going to test her visual fields. So what I'm going to do, Leslie, is I'm going to have you cover the same eye as me. Okay. Cover the same eye as me. And I want you to tell me when you see my fingers.
I see them.
Okay.
Still see them. Still see them. Still see them.
Okay. Now cover your other eye. And tell me when you see them.
Still see them. Still see them. See them. See them.
Okay, excellent. And this was normal. Next, I'm going to move on to the nose. I'm going to inspect her nose. I'm going to be looking for structure and symmetry, which her nose appears normal. I'm going to have her check for patency. I'm going to have you hold your nostril and breathe in, and the other side. And this is normal. Next, I'm going to be looking at her nasal mucosa. So I'm just going to look in your nose real quick, okay? Everything looks normal. Her turbinates are normal. Her septum is midline. It's not deviated. Her mucosa is pink and moist. And I did not see any polyps or exudate. Next, I'm going to move on to the ears. I'm going to inspect Leslie's alignment and symmetry. I'm going to be looking for any lesions, masses, anything abnormal with her ears. I'm going to begin by palpating her auricle. Tell me if you have any pain.
No. No.
Okay. Now I'm going to look in her ear. I'm going to be looking at her tympanic membrane. And her TM is pearly gray. There was no bulging or redness, and all of the Miller marks are visual. And this is normal. Next, I'm going to perform the whisper test. Leslie, I'm going to have you cover up your right ear first, and I'm going to come behind you. I'm going to whisper a word. I need you to repeat it for me. Okay.
Apple.
Excellent. And now I'm going to have you cover this ear.
Baseball.
Excellent. Next, excuse me, I'm going to test, I'm going to conduct the Weber-Renée test. What I'm going to do with this is I'm going to bring it right here. I'm going to hold it up on the top of your head, and I need you to tell me whether you hear it in both ears, one ear, or the other. And then I'm going to come back here, I'm going to put it on your mastoid bone, and I want you to tell me when you stop hearing it here, and stop hearing it here next to your ear.
Okay.
Okay?
Both.
Very good. And then we're going to go behind, we're going to do what I just said, behind your ear. When you stop.
Okay. Stop. Stop.
Okay, excellent. And this is normal. Air conduction is twice as long as bone conduction. Now I'm going to start on the mouth and pharynx. I'm going to be inspecting the lips. They're pink and moist. I'm going to be looking at her buccal membranes, her hard and soft palate. I'm going to be looking at the uvula, seeing if it's midline. Okay, her uvula is midline. Her tonsils are 2+. Her membranes look good. I'm going to assess her gum lines on each side. Okay. At the same time, I'm inspecting her teeth. I'm looking for any cracks, missing teeth, malodorous odor, any signs of infection, which all seems to be normal. I'm going to inspect her tongue. And lift her tongue up. Excellent. I'm looking at the floor of her mouth and underneath her tongue for any masses or lesions. I did not see any. Her tongue is nice, pink, and moist. And the movement is symmetrical. And next I'm going to test her gag reflex. Okay, I'm going to have you open your mouth and say ah. Excellent. Swallow. Great. Her uvula raised, and this is normal. Okay. Next, I'm going to inspect her neck for symmetry, smoothness, color. The color seems to be normal. I'm looking at the thyroid to see if there's any enlargement. I'm looking for it to see if there's a goiter. I'm also going to inspect for JVT, which I do not, she does not seem to have. If I were to test for this, I would lay her supine at a 45-degree angle, and that's how I would check it. Next, I'm going to move on to palpate the trachea, and the thyroid. Okay. And her trachea is midline. Okay, swallow for me. Okay. Good. Having her swallow, she did not have any enlargement or nodules that I noted. Okay. Next, I'm going to assess her lymph nodes. And assess the pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental, anterior deep and superficial clavicular, and posterior superficial clavicular, supraclavicular, and infraclavicular, and axillary. I'm just going to raise your arm a little bit. I don't want to hurt you. Okay. Excellent. And these are all normal. Next, I'm going to assess for active and passive range of motion. I'm going to have you touch your chin to your neck and back and side to side, and shrug your shoulders. Excellent. Now I'm going to have you do it with resistance. Let's shrug your shoulders. Excellent. Forward and back. Excellent. And side to side. There you go. There you go. Don't let me push. There you go. Excellent. Okay. Next, I'm going to move on to, I'm going to auscultate the carotids and the thyroid with the bell of my stethoscope. And this is normal. Next, I'm going to move on to the upper extremities. I'm going to be inspecting the shoulders, the arms, and her hands. I'm looking for any abnormalities with skin color, which is normal. Her temperature is nice and warm. Her arms, she's nice and warm, which is normal. I'm going to be inspecting and palpating for any masses, anything out of the ordinary. I'm going to be checking for muscle tone. Okay. Let me know if you have any pain.
None.
Her fingers, I'm going to assess her capillary refill, and it's brisk and less than 3. She has no clumping or any signs of cyanosis, and that's good. Next, I'm going to palpate her brachial and radial pulses. And these are normal, 2+ bilaterally and equal. I'm also going to check her carotids. And this is normal. Next, I'm going to move on to the back and chest. So if you can kind of, scoot down this way a little bit, that's perfect. Just be careful because you're going to be on the edge here. Okay. Yep. So, you know what? Can you just turn on an angle just a little bit? Yes, there we go. That's perfect. Just like that. You good? Mm-hmm. And move on. That way? Yeah. Just don't want you to very much. There you go. Okay. Looking at Leslie's back, I'm inspecting for symmetry. I want to make sure that there isn't any abnormal curvature like kyphosis or scoliosis. I'm going to palpate her vertebral column and check for any pain or masses. Bend over, just put your head down for me. There you go. Any pain?
No, ma'am.
going to palpate her back, looking for any pain or masses.
No, ma'am.
Okay. Next, I'm going to move on, and I'm going to do I'm going to test for tactile fremitus. And so what I'm going to do, Leslie, is I'm going to put when you feel my hands on your back, I need you to say the number 99.
Okay.
And I'm going to have you repeat it until I stop. Okay?
Okay.
All right. All right. Go ahead.
99, 99, 99, 99, 99, 99.
Excellent. Now I'm going to percuss palpate laterally.
99, 99, 99.
And I'm going to come in front and do it anteriorly.
99, 99, 99.
Tactile fremitus, you want to make sure that you are comparing each side doing it, and also it's best heard posteriorly and laterally at the bifurcation of the bronchi. Next, I'm going to move on to thoracic expansion. I'm going to put my palpate with my thumbs at approximately her 10th rib. I'm going to have you breathe in and out, and in and out. Excellent. And this was normal. Next, I'm going to percuss. I'm going to do this posteriorly, laterally, and anteriorly. And I'm going to compare sides systematically. I'm going to have you put your head down. Now put your hands just kind of like above your head. Excellent. I'm going to percuss laterally. And just keep your arms up for me. I'm going to also percuss anteriorly. Okay, you can put your hands down. When percussing, Renaissance is a expected sound, and this was normal. Next, I'm going to move on to CBA tenderness. Just let me know if you feel any tenderness or pain.
No pain.
Okay, excellent. Next, I'm going to test for diaphragmatic excursion. I'm going to start at the scapular line and work my way down until I hear dullness. I'm going to need you to take a deep breath in, Leslie. Okay, I'm going to mark right here, and I'm going to move from the bottom up until I hear dullness. And I'm going to mark here. This is approximately a 3 centimeter space, which is within normal limits. And next, I'm going to auscultate the lungs. I'm going to do this systematically, comparing side by side. I'm going to do this posteriorly, laterally, and also anteriorly. Okay, I'm just going to need you to take some deep breaths for me. And now I'm going to percuss laterally. I'm just going to, yeah, there you go. Deep breaths in. Excellent. Now I'm going to auscultate anteriorly. and this is normal. She did not have any adventitious breath sounds, and her lungs were clear to auscultation. So Leslie, now I'm going to have you turn and sit facing the way we're just facing. I'm going to now inspect her anterior chest and heart. You're okay. Okay, you're okay. So I'm going to start by inspecting the skin. I am looking at color. I'm looking at symmetry. I'm going to be assessing her respiratory rate, her respiratory effort. Right now, Leslie is, she's not showing Leslie is not in distress right now, and she's not using any accessory muscles. So upon inspection, I'm also looking for pulsations, lifts, or keys visible to my eye, which I do not see. So now I'm going to move on to palpation. I'm going to palpate for pulsations, lifts, and heaves. And this is all normal. I'm also going to palpate for any crepitus, pain, or masses. And any pain?
No pain.
Okay, and this all seems to be normal. Next, I'm going to auscultate the heart sounds. I'm going to start at the aorta, at the second intercostal space, the right sternal border. I'll move on then to the pulmonic and listen to that at the left sternal border and the second intercostal space. I will move down and listen to herbs at the third intercostal space, the tricuspid at the fourth and fifth intercostal space, and the mitral at the fifth intercostal space. And now I'm going to palpate the PMI at the fifth midclavicular. And next, as I'm listening to the heart sounds, I'm looking, I want to hear the S1s and S2s. I'm also listening for any S3s, S4s, split S2s, and possibly murmurs or bruits. And again, I'm going to listen for the murmurs or bruits with the bell of my stethoscope. Okay, and I did not hear any murmurs or bruits. Next, I'm going to check for any aortic regurgitation, and I'm going to have you lean forward. Okay, and I'm going to listen at the left sternal border of the apex. And this is normal. Next, I'm going to move on, and we're going to take a look at your abdomen. Okay, so if you can just lay down on the pillow there. You can scoot back a little bit too. And you can leave your legs up. You can leave them up. Just like that. Perfect. Yes, please. Good. Yep, perfect. I'm going to be looking at Leslie's contour of her abdomen. I'm looking for any pulsations. I'm looking at her coloring, any masses, any visible masses, rashes, anything abnormal, movement. Everything right now looks good. Her color's good, and visibly I don't note anything. I don't see any ascites. Her umbilicus is midline. So next I'm going to auscultate all 4 quadrants. Might be a little cold. I'm doing this with the diaphragm of my stethoscope for 2 to 5 minutes. And I heard bowel sounds in all 4 quadrants. Next, with the bell of my stethoscope, I'm going to be auscultating the arteries, the aortic, the renal, iliac, and femoral. Next, I'm going to palpate for the femoral pulse, and this is 2+ bilaterally and equal. I'm going to assess the, or palpate the width of, palpate the aortic width. I'm looking for any excessive pulsation, which I do not feel. Next, I'm going to do light palpation. And now I will do deep palpation. Let me know if you have any pain or discomfort.
No pain.
Okay.
No pain. No. No pain.
Okay. I'm going to percuss all 4 quadrants for tympani. And this is normal. Next, I'm going to palpate for liver span, and I'm going to start down here. I'm going to percuss until I hear dullness. Okay, I'll mark right here, and I'm going to percuss down from the midline until I hear dullness. And that's approximately 6 centimeters and within normal limits. Next, I'm going to percuss for splenic dullness. And this is normal. I'm going to check the liver border. Okay, I'm going to push in deeper in there. And the liver border is smooth and without nodules. I'm going to palpate the right and left kidney. I do not feel this is normal. And lastly, I'm going to check your abdominal muscles and check for hernia. So if you can just lift your head up. And this is normal. Great, now you can sit up. Thanks. Next, if you can hang your feet off the side, I am going to inspect her lower extremities. I'm going to inspect her legs and feet. Her color looks good. The skin and hair distribution is normal. I don't see any edema. Looks good. I'm going to palpate the legs for any pain or masses or any other abnormalities. Do you have any pain?
No pain.
Okay. Also checking for muscle tone, which is normal. Looking at her toes, I'm going to check her capillary refill. And it's brisk and less than 3. And there is no sign of cyanosis or clubbing. Next, I'm going to assess her popliteal pulses, posterior pevialis, and her dorsal pevialis. Okay, you can bend your knees. There you go. That's the popliteal, the posterior pevialis, and dorsal pevialis. And those are all 2+, bilaterally and equal. Next, I'm going to move on to the musculature. Oh, I'm also going to check temperature, and her temperature is good throughout. So next, I'm going to next I'm going to check her reflexes. I'm going to start with her brachial. Good. On her knees. And her Achilles. Good. And next I'm going to test muscle strength. I'm going to have you put your arms out in front of you and hold them up straight and push up. Push down. Excellent. Bend your arms like this and push forward and back. Excellent. I'm going to do the same with her legs. Here, further. There you go. Now push back. There you go. Push forward. Go. There you go. And the same with your feet. Okay. Excellent. And this is all normal. Next, if you want to come over here, I'm going to have you hop down. I'm going to stand back here. And you can just move up just a little bit. Can you squat for me? Okay, great. Great. And I'm going to have you, here, turn this way. I'm going to have you bend over. I'm going to check your cervical spine and lumbar spine. I'm looking for any curvatures. I'm palpating again for any pain or masses, which I don't feel. I don't see any kyphosis or scoliosis. You can stand up. And turn this way. So her back looks great. Also, earlier I had forgot to say that I felt her hair, and her hair is also nice and soft. And this concludes my physical examination. Thank you very much. Thank you, Leslie. Ta-da.